In a statement issued on May 27, State Minister for Health Sarah Opendi reassured panicked Ugandans that there's nothing like an Ebola outbreak in the country. We would like to inform the public that there is no Ebola outbreak in Mubende or any other part of the country. What was quoted in the media is rather a case of Crimean-Congo hemorrhagic fever, CCHF, she said on May 27. Minister Sarah Opendi revealed that on May 21, a 35-year-old male from Nkoko sub-county in Bugangezi County, Kakumiro district arrived at Health Care Clinic with a high fever and vomiting and was admitted for 2 days. Since he was not improving, the relatives transferred him to Gald Medical Clinic in Kakumiro district on May 23, from where he was referred to Mubende Regional Referral Hospital. The clinician on duty at Mubende Hospital immediately transferred the patient to the hospital isolation room where he received intravenous fluids, she said. Unfortunately, he died during that same night. Samples were taken off the body and were sent to the Uganda Virus Research Institute and they confirmed the deceased died of CCHF, not Ebola, she added. Opendi said attendants of the deceased, who included his expectant wife and 4 others, were immediately quarantined and are being monitored to mitigate any possible exposure from contact with the suspect. All materials used by the deceased, including a trolley and beddings used by the deceased, were burnt. All the hospital staff who got in contact with the deceased were provided with digital thermometers and were instructed to take their body temperatures twice on a daily basis, she said. How CCHF spread. Crimean-Congo hemorrhagic fever is a viral zoonosis, animal-to-human infection, and is caused by a tick-borne virus. The hosts of the CCHF virus are mostly wild and domestic animals including cattle, sheep and goats. These animals become infected after being bitten by infected ticks and the virus remains in their bloodstream for about 2 weeks, allowing the tick-animal-tick cycle to continue. CCHF is spread to human beings when they get in contact with infected ticks or direct contact with blood or tissues of an infected animal. CCHF can be transmitted from one infected human to another by contact with infectious blood or body fluids. Symptoms of CCHF include sudden onset of high-grade fever, muscle aches, neck pains, neck stiffness, backache, headache, sore eyes, vomiting, diarrhea, abdominal pain, and sometimes bleeding from body openings. In Uganda, the risk of acquiring and spreading of CCHF is high among communities within the cattle corridor. Ziranita 2015 @gmail.com